Hi, hello everyone. In this video, we are going to discuss about the brain tumors. Let's get started. So, what do you mean by brain tumor? It is a mass of tissues, okay, growth of abnormal cells that form a tissue. So, that formed as a result of abnormal, excessive, autonomous, uncontrolled, and purposeless proliferation of cells in a brain. So, it is a localized intracranial lesion or a mass or abnormal cell growth which occupies space within the skull. Okay, so what will happen? See, when normal cells grow old or get damaged, they will die and new cells take their place. Sometimes what will happen? This process goes wrong and new cells grows, and when body does not need it, and old and damaged cells do not die as they should. So it will leads to abnormal growth in the brain. And as we know that brain is a very rigid structure. Any growth inside this restricted area, what will happen? It cause problem because of these tumors which will grow inside the brain, that will increase the intracranial pressure, which will leads to brain damage. So this is the whole meaning of the brain tumor. Let's see the brief introduction of the anatomy and physiology of the brain. So brain is a remarkable organ that controls a multitude of functions in our body. So the structure of the brain consists of three main structures: cerebrum, cerebellum and brainstem. Cerebrum is the largest part of the brain, located at the front, and it includes the cerebral cortex, consists of gray and white matter. Cerebellum is situated at the back of the brain, and then brainstem connects the brain to the spinal cord. The functions of these three parts are: cerebellum plays a crucial role in movement coordination, temperature regulation, speech, judgment, emotions and sensory processing. Cerebellum, it responsible for balance, coordination and fine motor skills. Brainstem, it control essential function like breathing, heart rate and digestion. Okay, gray matter and white matter, it forms a outer layer of the cerebrum, and it contains neuro cell bodies, and it was involved in the processing and interpreting information. Okay, and this consists of neurons and glial cells. Now we will see the etiological factors. Exact cause is unknown, but based on the current state of knowledge, these factors are broadly classified under two main headings. Okay, so the first one is epidemiological factors and the second one is carcinogens. So what all will come under the epidemiological factors? Like first one is the family and the genetic factors, means if there is any history of brain tumor in the family, because genes will transfer from one generation to another generation. So these factors can lead to brain tumor. And the second is racism and the geographic factors, means the persons who will exposed to more to the sun than the persons who are not. So there also we have seen the chances of they will get the brain tumor. Okay, and the next is environmental factors. Environmental factors means the persons who are living in the polluted area, most polluted area, like smoking, air pollution, okay, water pollution. So in that factors also will play a role in getting the brain tumors. Cultural factors, see, cultural factors is not related to the religion rituals only. So it can be your habits, like food habits, your the smoking habits, drinking habit, that all will come under this. And the person who will infected with the HIV infection, so these all will also play an important role in the person to get diagnosed brain tumor. Age and sex also. Age means more the persons will be like adults will more prone to get brain tumors comparing with the children and the older age. Then sex means male persons are very prone to get the this disease comparing with the women's, because men's are very more prone to expose to this pollutant areas, environmental factors. Okay, so these are the reasons. Okay, for the causes comes under the epidemiological factors. Now we will see the carcinogens. So carcinogens, what do you mean by carcinogen? The word, it is the process by which a normal cell is transformed into a cancer cell, that is called the carcinogens. Okay, so chemical carcinogens means when you are exposing to the chemical agents like formaldehyde, vinyl chloride. Okay, this will leads to the develop the cancer cells in the body. And physical carcinogens and hormonal carcinogens means, physical means whenever we are exposing to the some like radiations, okay, radiations or chemicals to when it is coming in contact with your skin, okay, that is called the physical carcinogens. And hormonal carcinogens means when the carcinogenic event, either it is a potential or promoted by hormones, naturally or synthetic. Example like diethylstilbestrol or estradiol, which is considered as a hormonal carcinogens. So that will also affect the, these all the things will directly or indirectly will become the reason for diagnose or to develop a brain tumor. Now we will see the classification of brain tumor. Mainly it is divided into two types, primary brain tumor and the secondary brain tumor. Then what is primary brain tumor? It originates from cells and structures within the brain. And again primary brain tumor is divided into three subtypes. That is intracranial tumors, second one is tumors arising from the supporting structures, and third one is the developmental tumors. We will see one by one in detail. Okay, in the primary brain tumors, we will first discuss about the intracranial tumors. Okay, what is intracranial tumors? It is also called as gliomas. Okay, it is again in this there will come under different types of tumors based on the where it is affected. Okay, the first one is the astrocytoma, the tumor which arises from astrocytes. Astrocytes means star shaped glial cells. And the next type of cranial tumor is oligodendrocytoma, and it is a rare tumor which arises from the cells that make the fatty substance which covers and protects the nerve. Usually it occurs in the cerebrum. And the next type of intracranial tumor is glioblastoma. It is nothing but third degree or the fourth degree or grade of astrocytoma tumor. And the fourth type of intracranial tumor is ependymoma, and it mainly arises from the cells that line the ventricles or the central canal of the spinal cord, and most commonly seen this type of tumor in children. Last type of intracranial tumor is medulloblastoma, and this tumor arises in the cerebellum, and it is also called as primitive neuroectodermal tumor. Till now we have seen in the primary intracranial tumors. Now we are going to see the tumors arising from the supporting structure. So what all will come under this type? The first tumor is meningioma. The name itself it is telling that this tumor arises in the meninges. And the second type is acoustic neuroma. So this tumor will arise in the cranial nerve 8th. The third type of tumor is schwannoma. This tumor arises from the schwann cells of neuron. The next tumor is pituitary adenoma. So this tumor arises in the pituitary gland. The next tumor is penile region tumor. Okay, this tumor, it is a rare brain tumor which arises in or near the pineal gland. And the next one is germ cell tumor of brain, and this type of tumor arises from a germ cell. Till now we have seen the type of tumors arising from the supporting structure in the primary type. Now we are going to see the developmental tumor, which is the third type of tumors in the primary tumor. So first one is the angiomas. Okay, it is a developmental tumor. So that's why in the developmental stage only we will see. So it is form of a mass which contains the largely abnormal blood vessels will be found in that either or the on the surface of the brain, and mostly it will be seen in the cerebellum. And the next type of tumor is craniopharyngioma, and this type of tumor grow at the base of the brain near pituitary gland. So dermoid tumor, the third one is, so it is related to like integumentary parts. So it is a sac-like growth that is present at birth, contain the structures such as hair, fluid, teeth and skin glands that can be found inside the skull. The last type of developmental tumor is epidermoid tumor. This tumor occurs when the normal development cells are trapped within the growing brain. So it has a thin outer layer of epithelial cells surrounding the fluid, keratin and cholesterol, which all found in the growing brain. Till now, what all type of tumors we have discussed here, that all will come under the primary tumors. Now we are going to discuss about the secondary tumors. So what is it? It is the like metastasis lesions. Okay, if the patient is suffering with the other type of cancers or other organ parts of the cancer, that will travel and migrate into the brain. So this type of brain tumors comes under the secondary tumors. Now we will discuss about the pathophysiology of brain tumor. Okay, so what will happen due to the etiological factors like chemicals or radiation exposure? What will happen? There will be irritation and damage to the cell structure of the brain. That leads to what? There will be an adaptive mechanism will takes place. Okay, so what that mechanism it will be? There will we can see the changes in the cell morphology that will occur. So because of that, what will happen? Cells means the cells shape and size, everything is changing, and that change is irreversible. Okay, that change is irreversible due to the as the continuation means continuously there will be radiation exposure. That will what will happen? That cells become irreversible and causing the gene mutation in the DNA. Okay, so that will that leads to inactivation of tumor, suppresses the genes, and activation of oncogenes will occur. So because of that, there will be uncontrolled cell division will occurs, which will decreases the apoptosis, and that will lead to there will be hyperplasia of the brain cell. Hyperplasia means there will be the numeral uncontrollable cell division will takes place. More it will be presence in the brain, and that leads to brain tumor. In simple terms to explain means whenever the person will expose to the chemicals radiation, what will happen? Whatever the normal cells will be there, that will goes into the means there will be change in the cell morphology, means there won't be like a different size and shape of the cell will be changed. Okay, and it will be uncontrollable. The cell division will takes place uncontrollable, and there will be the accumulation of the hyperplasia means undeveloped cells and sizes will accumulate in the brain, which leads to brain tumor. Now we will see the signs and symptoms. In signs and symptoms, it is in the general symptoms. What are the generalized symptoms we will find out? Means there will be increased intracranial pressure will be there because of their presence of tumors. Excessive mass will be present in the brain. So that will what will happen? It will compress the adjacent organs, means adjacent parts of the brain. That leads to increased intracranial pressure, and there will be vomiting, like a projectile vomitings will be seen, and visual disturbances like diplopia, papilledema, then loss of visual acuity. Okay, headache, and headache most commonly seen in the early mornings, and it will be made worse by coughing or straining. And localized symptoms, we can see that hemiparesis, when it is like experiencing the one side weakness of the arms, hands, face, chest, legs or a feet. Okay, then seizures can be seen, mental status changes, the patient is not able to find out like means day, time, okay, like that. Then alteration in cognition, means cognitive organs, means cognitive developments like movements like also will disturbs, and personality changes in case if there is a presence of the frontal lobe tumor. And sensory defects means the patient is not able to smell, hear. Okay, language disturbances will be seen like aphasia. Okay, aphasia is the inability to comprehend or formulate the language because of the damage of the specific brain regions. These are the common generalized and localized signs and symptoms of the brain tumor, but symptoms will be differentiate depends upon the where the tumor is located in the brain region. Okay, depend upon that region, the symptoms can vary. Now we will see the complication. Okay, the complications which will develop by the brain tumor are meningitis, respiratory collapse, seizures, and cerebrospinal fluid leak will be there, paralysis, memory loss, and mental confusion. What all the diagnostic measures of the brain tumor? The first is history collection. You have to collect the history, if there is any family history or genetic, because family history and genetic factors also responsible for the brain tumor. So you have to collect the detailed history collection of the patient. Then neurological examination you have to do. What all will come under neural examination? That mental status, like cranial nerves. Mental status means you have to ask the patient about the time, okay, any events, okay, date, like that. Then cranial nerves, then motor function, sensory function, balance and walking, reflexes and coordination. These all will come under the neurological examination. Then you have to do this CT scan, okay, computer tomography scan can be done. Then MRI scan, okay, magnetic resonance imaging means slides of the brain, actually where which part of the brain is affected, that can be seen in the MRI. Then cerebral angiography can done. Then PET, positron emission tomography. This is also one type of diagnostic measure to study the brain. Then EEG, that is electroencephalogram, like ECG it will be. Okay. Then cytological studies of the cerebrospinal fluid. So these are all the diagnostic measures you can see in order to find out which type of the tumor it is. So now we will see the management. So we will discuss the management under medical management, surgical management and nursing management. So first we will see the medical management. Okay. So medical management, what is the goal of medical management is to remove or reduce as much of tumor's burden as possible and to manage the intracranial pressure. And the next is to control and prevent the seizures and to monitor the motor and sensory deficit. And the medical management, whatever the treatment includes, it is not a one model. It usually multi-models in order to prevent or treat the brain tumor, because one treatment is not enough for the to control or treat the brain tumor. So what all it comes first is the medication, that we will give the anti-epileptic drugs therapy such as phenobarbital, diazepam, GABA inhibitors, phenytoin. And supportive therapy also we will give, like steroids. Okay, most patients with the brain tumors need steroids to help or to relieve that swelling of the brain. So for that we will give a drug like dexamethasone, okay, anticonvulsant medicines, okay, in order to treat the seizures. And shunt also will included, that is if fluid builds up in the brain, so the surgeon may place a shunt to drain that fluid, so to drain or to divert that fluid. Okay, this all will come under the supportive therapy. And what is radiation therapy? So in the radiation therapy, like implantations will come, brachytherapy, teletherapy. So what is brachytherapy? It is like a surgical implantation of the radiation source, like iodine 131, which will deliver the high dose of radiation at a short distance for high grade malignant tumors, so while minimizing the effect on the surrounding brain tissues. So it will implant in the brain itself. So that all will come under the radiation therapy. And chemotherapy. So what is chemotherapy? It is the we will use the drugs to kill the cancer cell. Okay, it may be given by mouth or injection. Okay, so for some of the example of the chemo drugs are the procarbazine, temozolomide, interferon, cisplatin, carboplastin. So these all will come under the medical management. Now we will see the surgical management. So what is the main goal of surgical treatment is to remove or destroy the entire tumor which is increasing the neurological deficits, and to relieve the symptoms by partial removal. Treatment modality depends upon the type of tumor and its location and accessibility. So what all the surgical treatment is done in the brain tumor is, first one is the craniotomy. It is the treatment of choice of removal of tumor, and this procedure is performed under general anesthesia. And another one is transsphenoidal microsurgical removal of tumor. Okay, this is the approach to assess the pituitary gland through nasal cavity and sphenoid sinuses. And this will be done the MRI scan. With the help of MRI scan, it will locate the tumor where it is, but it is used by the after destroying the tumor by the laser treatment. And this is the procedure be used after craniotomy to remove the remaining tumor tissue. And the third one is the debulking surgery. It is the partial removal of the tumor, can improve the quality of life by alleviating the symptoms, signs and symptoms. Sometimes it will improve the effectiveness of radiation therapy or chemotherapy. And now we will see the nursing management. Okay, in the nursing management, what it will include, it include the baseline data. Okay, you have to collect the history collection, physical examination you have to done, which includes the pain, respiratory problems, bowel and bladder disorders, sleeping disturbance, impairment of skin integrity, temperature regulation. This all will come under the physical examination. And you have to take the baseline neurological examination also you have to done in order to make a nursing diagnosis. Now based upon the assessment, you can make the nursing diagnosis. So here few of nursing diagnosis I am discussing. The first one is anticipatory grieving related to potential loss of function and previous ability from brain cancer. So there will be grieving will be present in the patient. So what do you have to do for this? So what are the nursing interventions can you plan for the patient? Means you have to assess the first patient's knowledge. Okay, how much he ever knows about the disease condition. So you have to explain and discuss everything, what all the questions will rise in the patient's mind. You have to explain everything in detail patiently. Okay, what all the treatments are there, when he has to approach, or when he means about the like treatment modalities you can explain. You can give the health education on that. Then whenever he has to come for the checkups, okay, what all the treatments he has to take in order to prevent the complications or further deterioration of the brain damage or brain tumor or further deterioration of the disease. So you can plan this all the things under this nursing diagnosis. And the next is ineffective breathing pattern related to cerebral edema or increased ICP. Because of there is a presence or increase the intracranial pressure, what will happen, there will be the altered the brain function. When the tumor is present in the respiratory or breathing function ability like brain stem, okay, because there only the involuntary actions will takes place. Okay, so like this, if it is there anything, you have to comfort the patient by administrating the oxygen and positioning the patient. Okay, and with how much ever the tumor is present. Okay, if it is in initial stages, he can take the medicines. Okay, so like that you can plan the interventions to the patient. And the next diagnosis is imbalanced fluid volume related to ICP or diuretics. ICP means intracranial pressure. In order to decrease the intracranial pressure, the doctors will keep the patient on the diuretics. So what are the nursing interventions you can plan here? Means you have to maintain the output chart. Okay, input and output. Okay, then you have to this one, in order to decrease the ICP. To decrease the ICP, you can engage this one, elevate the head of the bed to the 30 degrees level. What will happen, that that position will allow the pressure to be decreased in the brain. Okay, like this also you can plan for the interventions. The next diagnosis is ineffective coping mechanism related to fear of changes in body image, role performance or life expectancy. And another one is anxiety related to uncertain future and prognosis. For this, you have to help the patient to relieve the anxiety and encourage the family members or significant others who are taking care of the patient should tell them to assist in the meeting the needs of the patient. Okay, and you can, in this you have to assess the neurological status and vital signs frequently and compare with that baseline values. Provide for total self-care requirements. Encourage the planning for each day, how to take care of them. Other interventions which can help the patient to take care of the brain tumor is the maintain the body position without flexion of head and reduce the hip flexion. And for patients with visual field deficit, place materials in the visual field only and provide appropriate care and teaching for chemotherapy patient. Maintain adequate hydration and nutrition. Perform oral hygiene before and after meals to improve intake. Monitor the intake and output chart. Okay, then maintain normal respiratory pattern. Suction the mouth and throat if needed to maintain the airway. Prevent the patient from injury. So these are all the some of the interventions you can utilize or use wherever it is required for the brain tumor patient. Now we will see the rehabilitation, which will usually come after the treatment of the brain tumor. Okay, first one is the physical therapy that involves the improving the strength and the motor function. Speech therapy, it involves restoring the ability to speak clearly. Occupational therapy, it involves the restoring the normal daily functioning by the help of occupational therapist. The therapist will help the patient to manage the activities of daily living such as eating, using the toilet, bathing, dressing, grooming, etc. These all will come under the rehabilitation. Now we will see the preventive measures. See, always prevention is better than the cure. So what all the preventive measures we can take for the brain tumor is there are three levels. Primary level. In the primary level, what can able to do? You can avoid the known risk factors. Now we know what all the risk factors which will develop the brain tumor. So that all you have to avoid it, and avoid excessive use of cell phones. Nowadays it is using so much. So don't use excessive use of cell phones, and don't keep on the under the bed while sleeping, and avoid the exposure to the radiations. That radiations can come from the cell phones also. So you just avoid the use of cell phone and the radiation of that which emitted from the cell phone as much as possible. And in secondary level, it is the early diagnosis and the treatment, and tertiary level you can have the follow-up care. The prognosis of the disease will depends upon the site and type of lesions, and groundbreaking new treatments are at hand for the treatment of many benign and malignant brain tumors. But before that, prevention is better than cure always. With this we come to end of the video. I always says that if there is any doubt, queries regarding about the video, please message me in the comment section. I will clarify your doubts. Until then, take care. Bye. We will meet in the next video.